move over to the United States, where we hear that the death toll keep rising and the Donald Trump's government have been overwhelmed. And let's just watch what he said. The latest is that the black Americans, that's African Americans, are being affected. They have the highest death toll as at Tuesday night. Let's hear Trump.
The African community, and we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot, but it's been disproportional. They're getting hit very, very hard. In fact, while we have Tony here, I'd like to maybe have you come up and address that one, and then I'll continue. But if you could address that, it would be great, Tony, please.
Yeah, thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications.
Mr. Trump and the committee that are handling the coronavirus scourge in the United States. And now we'll just get updates from the U.S. as we'll join Dr. Godwin Maduka via Skype from the U.S. He is the CEO and medical director of Las Vegas Pain Institute and Medical Center. He's also a medical practitioner. Thank you very much, Dr. Maduka, for coming on the show.
Thank you.
Dr. Maduka, as a Nigerian, and with the latest report that we just heard from Trump, that this is affecting African Americans, they're dying more. What does that mean? You're also a doctor.
Well, as you've seen, one of the doctors have said that some of these coexisting diseases and some of the problems that are prevalent on the African Americans is contributing to this, the problem they have here. I don't think it's the same thing with Nigeria, because some of the problems they have here in African American community is not the same that you have in Nigeria.
When you say not the same, how do you mean? Coronavirus is the same everywhere. You said it's not the same. Yes.
I'm talking about in terms of the type of problems that we have, the African American community have here in America. The coronavirus is the same, but the type of problems that we have here as African Americans are not the same type of problems that we indigenous Nigerians have.
But initially, there was this kind of, can I say it was a myth, or can I say it was a wrong information that the coronavirus does not affect the blacks? As a medical doctor, people still believe that that virus does not affect the black race. How true is that?
No, I think it's not true. Coronavirus do not affect one race more than the other. I think we have the capability of being infected just like any other race. So that's a wrong impression.
All right, doctor, let's take a look at how it is affecting the day-to-day life of those in America. We saw Trump, we all keep seeing Trump on a daily basis addressing the media, trying to say we'll get over this. But it seems that the virus, the death toll in America is not the highest globally.
Well, the problem we have here in America, you see, America is the hub of the world. I mean, most people come to US, and that's why we seem to have more of this problem than any other country in the world. it's been difficult to contain, but I think it's getting better now. As far as we're concerned, we're doing this social distancing, making sure that people stay indoors, as well as shutting down the businesses, and hopefully this will help us down here.
Now, let's look at the death tolls. National governments all over the world are already fidgeting. Does it mean that they were not ready, or it seems that it took them unaware? Not just in the US. We just spoke to a pharmacist from the United Kingdom. He also gave us the same report that the numbers keep rising, and in some parts of Africa too. It's overwhelming. So does it mean that the government of these nations didn't prepare for this magnitude of attack?
Well, let me just say you something. I don't think a lot of people are prepared for this coronavirus. It has really nothing to do much with the preparedness of the nations or the communities. So as far as we're concerned, we're still learning a lot about this virus. And most people are beginning to understand it. So if it is very much a problem here in UK, in UK as well as in US, is because most of our business is person-to-person interactions is more than any other nation.
Dr. Maduka,
Yes.
now what are the lessons, the takeaway from the pandemic in terms of meeting the needs of the people, as well as attending to the frontline medical experts who are also in the field trying to battle this virus?
You know, it's very, very simple. Now we understand now how this virus is being transmitted. Especially for Nigeria, the best thing to do is do lockdown. People should stay indoors. Everybody should have mask on and do the sanitization process. I think and I believe the Nigerian government is doing their best, better than I've seen. And all these local state governments are doing good as well. So my advice is for people to stay indoors. We as communities, state or federal government or private individuals should make available food to people that are locked in, and so that at least they will have a nutrition while they're indoors. I believe that if we extend the lockdown, the virus cannot exist forever. And if it doesn't go from one person to another, there's no reason why it continue to be. So the best thing to do is to shut down every operation, get everybody in-house, and let this in pass.
But when you talk about shutdown, you know that the case in Nigeria, you are also in Nigeria, and though a doctor living in the US, the case in Nigeria, when compared to the other world, it's peculiar because a lot of persons complain of poverty, hunger, starvation, and you want them to remain indoors from now to whenever until the virus disappears. You have made a statement, the government should provide. What do you think?
Again, this is one where all of us have to work together. The government, the private individuals, the well-to-do individuals, the church, the Muslim mosque, any community, any of these groups will help the less privileged stay indoors. Okay, that's the answer. That's the best answer to give, is that all of us stand together and come up with some resources to take it to the people that need it back home, both in the local as well as urban areas of Nigeria. You understand? So that's the best way to do this. We can try to get our ventilators. We can go ahead and try to get the best medical terms. The problem is this virus is less understood than most people even know. It's a very serious infection that can be prevented. And one of the best answer, stay indoors. Government and individuals can come up and see what they can do for the less privileged, so they can stay indoors, because when it comes out, we will not be able to withstand the outcome.
Okay. Now let's take you to lessons learned. We've seen reports where health workers are victims. In Nigeria, about 30 plus doctors are all in isolation now, with the fear that they didn't know particular patient was with the virus, and they were not well protected. So they have asked all of them to go on isolation. We saw what happened in China. We saw the cases of frontline medical experts dying across the world. Now, what is the take home? How do they manage this? Because a lot of persons are concerned about the health workers.
Okay, now let's make it simple. We, the health workers, just have to understand that you can't look at anybody's face and know they have the virus. So we have to protect ourselves and protect our families. That is very, very important. The health workers, when they go out there to take care of people with coronavirus, know the dangers they are going to be facing. So again, we protect ourselves, wear masks, wash our hands, sanitize as much as possible, and make sure that we do not get ourselves infected. But this is going to be very difficult because the doctors are dying and somebody had to take care of it. But that goes back to what I was saying earlier. If we keep people at home and then provide them with the water and food and keep them at home 1 month, all this thing will be over, because the virus can't live forever. And then you make it easier for, unfortunately, this is a problem. Doctors will die because they're dealing with this contagious agent.
Virus.
And that's part of our job.
All right, thank you very much, Dr. Godwin Maduka, for coming on the show. I really appreciate your contributions on the show. We'll also be calling you when the need arises. Thank you.
Thank you very much.
All right, that was Dr. Godwin Maduka, the CEO and Medical Director of Las Vegas Pain Institute and Medical Center. He's also a medical practitioner. We just spoke to him all the way from Las Vegas. Thank you very much for being a part of this show. Remember to follow me on my handle at EJ Osamo. We will